Hello, welcome to the Skills webinar training series. My name is Evelyn Gould and I am a clinical trainer for the Institute for Behavioural Training. And I'm here today, I've been invited into the studio to talk a little bit about how we might enhance behavioural parent training with acceptance and commitment therapy. We only have an hour today, so I'm not able to give you all the information I would like to give you, but I'm going to hopefully whet your appetite in terms of learning more and get your interest going on this topic. So our objectives today, I'm going to first just talk a little bit about the importance of parent involvement in ABA programs for children with autism. And then I'm going to discuss some common barriers to effective parent training. Specifically, I'm going to focus on the influence of private events on parent and child, and then at the very end talk a little bit about how private events might affect clinician behaviour as well whenever we're involved in parent training. And I'm also hoping to, I will be introducing acceptance and commitment therapy to you all as a potential strategy for improving the effectiveness of our parent training program. So how ACT can help us deal with the problematic private events that might be preventing us from getting the best outcomes from our training programs. So we all know that there's been a rapid increase in the diagnosis of autism spectrum disorder in the past number of years, and the current numbers is around 1 in every 88 children having a diagnosis of ASD. And of course with that then we've seen a big increase in demand for services, and with that people needing cost-effective ways to bring services to all the families that need it, including families who might be in more remote locations that are more difficult to reach. And we also know that the increase in demand for services has not necessarily been met with the availability of clinicians to provide those services, so the demand kind of outstrips the supply at the moment. So cost-effective and models that can provide services to more families are necessary. We also know that behavioural parent training is particularly effective. It's very well researched in terms of an intervention for parents of children with ASD. Parents can be very effectively trained to not only address skill deficits but also problem behaviour of children, and it's a way for us to increase the number of treatment hours that children can be provided with, because parents can provide kind of around the clock intervention for their children if we give them the training that enables them to do so. So it's also cost effective in terms of increasing intensity of treatment. So through the literature, like I mentioned, we know that behavioural parent training programs are designed to teach parents both evidence-based strategies that address the core deficits of ASD, so communication, adaptive skills, academic skills, social and cognition skills, a whole variety of deficits across the spectrum. And in addition, that the behavioural parent training programs can help parents deal with challenging behaviours effectively as well. And in addition to improving child outcomes, so obviously our typical focus with behavioural parent training is to improve the outcomes that we see with children who are receiving ABA services, but we also know that in doing so we can improve outcomes for parents. And we can actually improve the overall quality of life for families. So simply by helping them access maybe more routines, leisure activities, they can kind of, even if it's something like accessing a family holiday that they weren't able to, and giving them the skills to be able to take the child to the doctor or function in the community. So it really increases the quality of life for the whole family. And in addition can decrease parent stress and increase feelings of parental competency, so helping parents feel better about their parenting skills and their improving their relationships with their children. So the problem is that even though we know that behavioural parent training works, we often encounter barriers to providing effective training. So even when we're able to teach parents specific skills and we can see that they have learned the skills and can demonstrate them for us, sometimes we experience compliance issues when we're working with parents, and it's a very, very common problem. I hear the clinicians that I work with talking a lot about what do I do? I can't get the parent to implement this program. I know they can do it, but for some reason they're not able to do it consistently, or they're not doing it at all. And the problem with compliance is that we know that that can significantly interfere with the child's progress if we don't address it. However, despite being a common problem, there actually has been very little research looking at the contingencies involved or the methods for improving parental adherence. So there's a few studies out there where researchers have tried to put in place some, for example, reinforcement strategies to improve parent adherence. So they've done things like token systems and lottery and other types of reinforcement systems. In addition, sometimes they've done contingencies where parents must submit data every day in order to continue receiving services. So there have been some attempts, but we really don't yet understand what the variables are that are involved, or really what the most effective strategies are for overcoming compliance issues. And I see the clinicians, again, the work that I work with, really struggling with what to do. So there is one paper by Allen and Warzek. They actually attempted to provide a behavioural analysis of the contingencies involved in parental non-adherence, particularly or with respect to parent training protocols. And it appears in JABA in the Journal of Applied Behaviour Analysis. And they identified the following as important. So they focused on looking at motivational operations, issues around stimulus generalization, response acquisition issues, and consequence events. But in some circumstances, you can have taken all of these factors into consideration. For example, you've made sure that you've taught multiple exemplars of all the skills or targets. You've trained across settings. You've basically ensured that you've watched the parent demonstrate the skills in all the situations and settings that they need to. And in addition, you've prioritized your targets as well. You've made sure that things are not too complicated. You've taken into account other contextual variables. You've made sure that you've conducted evidence-based skills training, so behavioural skills training. You haven't just talked at the parent for 15 minutes and then left them to it. You've made sure you've gone through modelling and demonstration and practice and so on. And you might have even put in place some really great reinforcement strategies, or some kind of strategies to that will compete with some naturally occurring schedules or contingencies that could interfere or compete with what you're trying to do. So often you might have done all of that, and yet you still might have compliance issues there. You might still see a parent who is resistant to what it is that you're trying to do, or is having a really hard time with following through with the protocol. So it's been suggested that another thing that could be happening in those types of circumstances where you've ruled everything out, the role of private events might be important, and that's really the focus of the talk today. We're going to talk about how private verbal stimuli might be controlling parents' behaviour and what to do about that. Okay, so just for consideration for behaviour analysts, sometimes when we start talking about private events, or we start talking about thinking, feeling, remembering and imagining, people get a little bit fidgety on their seats and they're not really comfortable with it. We don't talk a lot about thoughts and feelings and so on in behaviour analysis, or we haven't traditionally. But it's really important to remember that it is our business and it's something that we do need to care about. So Skinner himself talked about our comprehensive science of behaviour analysis, and within that we need to think about things like thinking, remembering, feeling, imagining and so on as all things that we're doing. So if they're things that we're doing, then they're behaviour, and if it's behaviour, then it's our business as behaviour analysis, and we need to consider those when we're analysing what's happening with parents. Okay, so in spite of that, even Skinner acknowledging way back when that these things are important and that they play a role in our behaviour, the role of private events has actually been largely ignored in the behavioural parent training literature anyway, up to this point in time. And also, even though we can't directly observe private events, I feel like, they're private. Obviously, if they're private, we can't see them. There's not something that we're aware of. But it is important to acknowledge that they exist and that they can potentially really influence a parenting behaviour and treatment programme success. So I think this is really a bit of a no-brainer for those of us who think about our own behaviour, and we know that the thoughts and feelings that we have can often really dictate the way that we behave, and we can kind of, despite the feedback that we might be getting from our external environment, we can behave in very rigid ways with respect to kind of what's going on for us in our heads, so to speak. So just to kind of think about parents with parenting a child with autism in particular and private events, we know from the literature that the challenges of raising a child with autism are consistently associated with high levels of psychological distress. And any of you who've worked with these families will know that that's most certainly the case. And in fact, when we look at parents of kids with all types of disabilities, parents of children with autism in particular show really high levels of stress and marital discord and mental health issues as well, actually. And that even for the parents whose children do significantly well in treatment, those parents can still continue to struggle with high levels of distress. It doesn't automatically go away once the child makes progress, and that's a really important thing to bear in mind. Often the sources of stress change, but that high level of psychological distress remains. And we also know from the literature that and experience, obviously you'll all relate to that, but high levels of psychological distress can significantly impact how well a parent is able to benefit from parent training and how well it affects like the ways that they manage their child's behaviour. Okay, so where we're coming at from this whole presentation is that we're thinking that private events, in particular covert verbal behaviour, so the kind of chatter and thinking that's going on, might play an important role in determining both parent-child interactions, so how parents interact with their child in general, and how well they're going to respond to parent training. So we might improve outcomes with our clients or our parents if we're able to incorporate effective strategies for dealing with these interfering private events. So one of the problems that I see a lot with respect to this whole private events issue is that the behaviour analysts often either fail to recognise or discriminate when a parent is maybe behaving with respect to something private versus what's going on for them right now in the moment. So they fail to recognise the role of private events or whenever problematic private events are happening. But more often than not, most of the clinicians I work with do recognise whenever stuff is showing up for parents and when they're struggling with something. But they just don't know how to effectively deal with it or what to do about it. And so what tends to happen, or the responses that I see most often, are either the clinician ignores private events or just doesn't do anything at all, just pretends it's not there, or just ignores it altogether and carries on, and then tends to kind of just resort to either a mentalistic explanation for why the parents are not complying. So you just kind of just giving up and saying they're just not motivated, or they don't want to do it, or they're depressed, the parent's depressed, as explanations for why they're not getting the results, and then just leaving it at that. Or they resort to these common sense type strategies. So typically the most frequent things would be like arguing or debating with the parent about what they're thinking and whether it's true. So trying to kind of challenge someone's thoughts. The parent says, I can't do it, and you say, yes, you can do it, and these are the reasons why, or it's too hard, it's not too hard. So you're kind of debating back and forth with the person about whether their thoughts are true or not. And the other typical thing to do is to kind of reiterate over and over again why the parent needs to do, why it's important that they follow your protocol, why the intervention's going to work, why they need to do it, showing data and saying, look at the data, and kind of just continuously reiterating why they need to comply, essentially. And most of the time, those things don't work. With some parents, possibly you might get a change in behaviour, but I think on the majority of times that is not going to work, and you're going to continue getting having the clinician and the parent kind of butting heads and not getting anywhere. So before we start talking about what we can do whenever these difficult thoughts and feelings that a parent's struggling with that's kind of getting in their way, when those things start showing up, before we start talking about what to do about that, we need to kind of understand a little bit more about these verbal processes that are going on, and like why these thoughts might be creating barriers or creating problematic behaviour. And the theory that we use to think about private events that's very useful is relational frame theory. And some of you may be familiar with RFT, others not so much. I don't have time today to go into RFT in depth, which will be a relief for some of you who may have come across it and find it quite complicated. I'm just going to touch on what it is and then talk about some of the core verbal processes that are involved that you guys need to know about when you're working closely with parents and coming across these compliance issues. And we're going to talk about rigid rule following and cognitive fusion in just a moment. But all you really need to know at this point is that relational frame theory is a behaviour analytic account of language and cognition, and it actually builds on Skinner's analysis of verbal behaviour. And it provides us with a theoretical framework through which we can understand the verbal processes that we're going to talk about and how context can lead to the maintenance of maladaptive parenting repertoires. So the first verbal process that we're going to talk about that's really key is rule-governed behaviour. So, like I said earlier, when a parent continues to show resistance to treatment, even though you've kind of set up the training situation and in the most optimal way, and you've picked your targets very carefully, and you've done really thorough behavioural skills training, and you've seen the parent demonstrate all the skills, if a parent's still not able to comply, it's possible that self-generated rules might be in effect. So what we're saying is that the parent's behaviour is being controlled by a verbal rule that they have established, rather than being controlled by the contingencies that are in operation in their environment. So rather than reacting appropriately to what's going on around them or what the world is telling them, they are continuing to rigidly follow whatever the verbal rule is that they have generated. And so what we know about rule-governed behaviour is that it's much less sensitive to changes as well in the contingencies in the environment. So essentially, in the 80s, so this one study by Hayes and his colleagues in 86, which has come into my mind now, they basically were showing that they had students come in and they were given instructions to press a button in order to move this little light around, and when they moved the light certain ways, then they could score points. And when they scored points, they were able to then exchange those points for money prizes. And what they showed was they compared different groups. So they gave a group no instructions about how to press the button in order to win the points. And then they told one group to press fast and another group was to press slow. And then they gave another group some very specific instructions on how to follow changes in the schedule that they were going to be presented with. And what they found was that the group who didn't receive any verbal instruction, so they weren't following any verbal rules, or it seemed like they weren't, they were very sensitive to changes in the schedule of reinforcements. They were very sensitive to how to win points, and they did very well with tracking the system and won lots of points. Whereas the two groups that had received either press slow or press fast, they noticed that they had very rigid behaviour. And even though the system, so the external contingencies, were telling them you're not being effective and what you're doing isn't working, they continued to follow the verbal rule anyway. They stuck to their either going fast or either going slow. And then the final group that was given the correct instructions to follow either going fast or slow depending on these lights turning on or off, they were very successful at tracking what was happening in their environment, and they were following those rules and being successful. So really the gist of all that research is saying that when there's verbal rules in effect, you will continue in some circumstances to follow those rules, even if the rest of the world is telling you that your behaviour is really ineffective and it's not getting you what you ultimately want. And that's what we see happening with parents sometimes. They'll continue to engage in these maladaptive parenting strategies despite information coming at them that is telling them that what they're doing isn't workable in the long run. So just to sum up, parenting behaviour is often or sometimes governed more strongly by verbal rules rather than by direct contingencies. And so that means that as behaviour analysts, we really need to be aware of when that could be happening and then think about strategies that might reduce control by those verbal rules so that parents are able to then come into contact with these contingencies that are going to be supporting more adaptive parenting and produce better behavioural outcomes in their children. So the second process to talk about today is cognitive fusion, which is you'll find within the RFT and ACT literature. And cognitive fusion is very similar or includes actually rigid rule following. And the technical kind of definition of cognitive fusion is describing when a person's behaviour is under the control of the derived properties of stimuli rather than by direct contact with them. So in the case of rule following, we see parents responding to the derived function of those words that are in their thought or in the verbal rule rather than responding to what is actually happening. And so when this happens, what we see in parents is we see an insensitivity to relevant contingencies that might maintain more adaptive parenting. We see them being very inflexible in their parenting strategies or showing us a very limited parenting repertoire. And we see parents who are having a really hard time with responding effectively to what's actually happening in the moment right now. They're too busy kind of wrapped up in their thoughts about who they are as a person, what's happened in the past, what's going to happen in the future. They're following these rigid rules and they're just not able to be effective right now. And we also see, like, as I said, those continued patterns of unworkable parenting behaviour. So the parents continue to do things that are really unworkable and unhelpful in the long run, even though they're being given information or alternatives that would be much more effective. So this little diagram kind of gives you a little picture or a metaphor for what cognitive fusion might be like for a parent. So you can see this little parent who is walking around holding this great big billboard in front of their face that says, "I'm a bad mother, I'm a loser, I'm stupid." And in this other parent here, you can see it's like, "I'm not good enough." And the problem is when you're fused with your thoughts is that you're really not able to respond to anything else that's going along. So you can see that this parent isn't able to cook or care for her baby or do the things that really matter to her. Because she's too lost in her thoughts and she's not, you can see even her hands are occupied and she can't really do anything else. And that's kind of what cognitive fusion is like. You're completely behaving from your thoughts rather than with respect to anything else that's going on. So what can we do about it? That's where ACT comes in. So acceptance and commitment therapy, pronounced ACT, not ACT. So ACT is essentially the clinical functional contextualism. First and foremost, it's the philosophical underpinning of ACT, and ABA as well, applied behaviour analysis, and relational frame theory that we just talked about. So with respect to the functional contextual part, that's pretty important because essentially ACT is really concerned about function. So rather than looking at the topography of language, so looking at the form of the things that you're saying or the content of what you're saying, ACT is concerned with how, with the function of the words that you're saying. So it's focusing on changing your relationship to the words rather than changing the content. And that's quite different from some other more cognitive approaches. So CBT has often would look at changing content of thoughts. ACT's not concerned with changing content. It's only concerned with function, and that shouldn't be too much of a difficult thing to get your head around as a behaviour analyst, because as behaviour analysts, we're generally concerned with how behaviours are functioning for us and not really what they look like. And the contextualism part just means that we can't understand how words are functioning for a person until we look at the context. So the context of the language is really important. And then ACT basically applies mindfulness and acceptance processes and commitment and behaviour change processes to create psychological flexibility. So at the heart of ACT is learning flexibility. For any of you who've worked with kids with autism, you will most certainly have encountered kids who really struggle with flexibility issues, and they behave in a very rigid way. For example, get very stuck in certain routines, or have to have certain things done in a certain way, have to go the same way to school every day, or have things happen in exactly the same way, or have their environment arranged in a certain way, or will only eat certain types of things or play certain games. So you'll all be very familiar with those flexibility issues, and if you are, then you'll also know how limiting it can be if you have those types of flexibility issues. It really prevents our kids from accessing learning opportunities. It prevents them from accessing other social situations, and from really participating in life and having a really functional life. And in addition, it also creates a lot of emotional reactions. So you think about the kids that you've worked with who've been very inflexible whenever something is challenged. So if they're very inflexible about a particular routine, when somebody then tries to change that routine, it evokes a lot of strong emotional responses in that child, because they want it to go back to the way that they want it to be. And that as well, those emotional reactions are very difficult and create a lot of barriers for that kid, and not only the kid but actually the whole family. And you find that the whole family's life kind of then starts to centre around maintaining the routine for that particular child, and so on. So at the heart of ACT, we're basically trying to do the same thing that you do with your kids. We're trying to create psychological flexibility. So we're concerned with getting flexible with our thoughts and feelings, or our thoughts, the verbal processes, as opposed to like external actions. But it's the same idea. And when we're very inflexible psychologically, we also really limit ourselves. We limit our ability to behave effectively and access lots of different opportunities for learning. And again, we also then have the emotional component. So it's really this, it's a good way to kind of think about it and get your head around when you're thinking about psychological flexibility. Just think about those kids and how restricted they are when they are behaviourally inflexible. So basically, through these processes that we're going to talk about in a minute, we're going to try and decrease the control by those rigid rules, the rigid rule following or the fusion, and increase that flexible repertoire so that we're then able to respond if we do have one of those difficult thoughts coming along, or the verbal rules, that we're able to respond to it in multiple different ways instead of just in this one rigid, inflexible way. So ACT does have a thriving research base, which all of you behaviour analysts will like, as well as it being a behavioural approach. That's another selling point. It has both research in terms of the basic science underlying ACT, so there's a lot of research in the RFT world and rule-governed behaviour and so on. And then it also has a great deal of research on the clinical end that looks at the effectiveness of ACT with numerous life problems and populations. They've shown the ACT to be effective from everybody from construction workers, improving safety or compliance with safety procedures in construction workers, to looking at improving the well-being of social workers, improving the performance of inline staff working with individuals with challenging behaviour. ACT with, actually I met recently a physiologist who had used ACT very successfully with insomniac patients and lots of mental health interventions. So ACT with patients with schizophrenia and hallucinations, and ACT for depression. And so the list goes on and on and on. It's not just a psychotherapy that is done on a one-to-one basis with someone with mental health issues. It's a toolbox of techniques that can be integrated into pretty much any situation where there's an issue related to problematic rule following or private events. And I mean, it's similar to ABA in that way. Like, we use the principle of reinforcement, and that can be used across the board with every person in this earth. ACT is the same. And it was officially classed as an evidence-based approach by the US government in March 2011. In saying that, there is currently only one published study using ACT with parents of children with autism. There's actually not that much research with parents in general, although it's growing. And there are some studies that are unpublished and some preliminary pilot projects in progress in relation to parents of children with autism. But this one study by Blackledge and Hayes in 2006 showed that a 2-day ACT workshop was effective in producing statistically significant changes in parent distress levels and mental health issues just with the 2-day ACT training. And other preliminary data is pretty promising too, and showing that ACT can potentially decrease parent mental distress, but also potentially improve their ability to manage challenging behaviour. So there is a couple of studies that have looked at measured decreases in challenging behaviour in the children following an ACT intervention. And there's one study which some work that Tim Weil is doing with his students, I believe, where they have been showing that there may be improved outcomes if you tack on ACT to traditional behavioural training program, and that they saw much better jump up in results whenever they added that ACT component. So to sum up, the great thing about ACT is it offers a behavioural toolbox, so to speak. So it's like a toolbox that you can add to the skill set that you have already as a behaviour analyst. And that these are research-supported techniques that effectively address problematic covert behaviour in parents. It's also a generalised skills training program, which is great, produces generalised change, so you can use it for meeting both specific objectives, so like helping a parent to get through a particularly challenging IEP meeting or something like that, to the more broad objective of producing this generally more flexible repertoire of behaviour and just enhancing well-being in general. And it might prove particularly useful for parents of children with autism. ACT is particularly helpful when the difficulties that someone is struggling with or the situation that that person is in is chronic and ongoing, and you can't just fix it through normal problem-solving strategies. And of course, we know that for these parents with children with autism, their situation is chronic and it's also stressful. And even no matter, like I said earlier, even kids who do very well or high functioning, parents still struggle with a lot of stress in relation to their parenting and their child's well-being and the outcomes for their kid. So our goal with adding ACT to the ABA programs, and certainly my goal with the organisation I work with, is to really thinking about maximising parent and child outcomes by doing these things. So firstly, we're trying to reduce the influence of problematic private events on parent behaviour. So we're really trying to increase psychological flexibility. And in doing so, we're hoping that we'll overcome those non-compliance issues and help the parent acquire, and not only acquire, but apply the parenting skills that we're trying to teach them. And what we also see is parents, we see improved buy-in from parents and a better collaboration between the clinicians and the parents, because parents feel like the context that they're operating within is being taken into account. So their thoughts and feelings and the stuff that they're struggling with is being taken into account and listened to. And the clinicians as well are able to, when they're trained in ACT, I think they're better at perspective taking, and so they're able to empathise with parents more. and you just get a more collaborative feel. And also, we want to improve parents' sense of well-being and parental competence as well. So, talking about the ACT model now, we're going to go into a couple of the types of areas that we could incorporate into our work, or the strategies we incorporate into our work. And there's 6 core processes involved in the ACT model. We're not going to talk about all of them today because I only have an hour. So we're actually only going to talk about a couple of them. I just pulled out a couple of them to focus on since we're strapped for time. But they'll give you a little bit of a taste. Essentially, all of the 6 processes interact with each other. And you can see from the diagram, this is called the hexaflex on the right-hand side. And you can see that each one of these core processes is kind of linked to each of the other core processes, with the overall effect of hopefully producing this psychological flexibility. So the 2 core processes that I've pulled out to talk about today are acceptance and diffusion. And I think that you hopefully will see how they relate particularly to parents embarking on a parent training program. Of course, like I said, the rest are important too. And if you were implementing full ACT with families, that you would need to think about incorporating them as well. But we just don't have time to cover them all today. So I have, first of all, diffusion is the first process we're going to talk about. And it's directly targeting that cognitive fusion that we were talking about earlier. And the technical definition of diffusion is to decrease the impact of problematic private events, for example, rules, by manipulating the contextual variables that influence relational framing and the transformation of stimulus functions. So that's a big garble of jargon right there. But for the less technical, it really just means that the behaviour analyst should be trying to change the parent's relationship with a particular problematic thought. So you're just altering its function or its meaning, and essentially then how the parent responds to that verbal stimulus, and then they're going to be able to behave differently. So you're targeting the relationship with that problematic verbal rule, so that it becomes a stimulus that the parent can respond to in a number of ways, i.e. flexible responding, rather than in just one rigid way. So hopefully that makes it a little bit more understandable. But if not, then I have layman terms. So this should also hopefully make it be more clear what this process is. And in layman terms, we're really talking about helping parents be able to look at their thoughts rather than from them, and therefore enabling them to behave more flexibly. So other ways to think about this are observing your mind. So being able to kind of have a thought, an unhelpful thought come into your head, and being able to observe it rather than get tied up in it or seeing it as truth. You're not seeing it as like something to be that's commanding you to behave in a certain way, or is telling you that this is the way the world is. It's just a thought or a sound. You're seeing thoughts as what they are and not what they say they are. Diffusion, we can think about it like unhooking from your thoughts. When you're very tied up and behaving in a very rigid, rule-governed way, you're kind of tangled up in your thoughts. So we can think of it as untangling, or loosening our grip on our thoughts so they're not dominating our behaviour in a problematic way. So here's a little cartoon that kind of is a good metaphor for what diffusion is. So we told him it's impossible, but he doesn't want to listen. So it's being able to have the thoughts come into your head, or have the thoughts, but not reacting to them as if they're truth. You can kind of let them play along in the background like a radio. And there's different ways to think about diffusion, and some people think about it. Myself, I tend to acknowledge my thoughts as like a radio. So I'll say, oh, there's a radio doom and gloom playing along again, or there's Crazy FM again. So I'm really or pop-ups, like these nasty pop-ups that keep popping up in front of my vision. So they're not actual things. I'm not seeing thoughts as actual scary tigers in the grass that need to be ran away from. I'm just seeing them as these things that are coming coming past me like ships. So diffusion-based interventions have growing support in the literature. A classic example of one of the diffusion exercises. Remember that the whole goal of all these exercises is essentially to loosen that control by the verbal rule so that you're able to respond more flexibly. So this example, Titchener's lemons. Titchener actually was a British psychologist, I believe, and he invented this little test. But essentially what you have the person do is you ask them to say the word lemon and think about the word lemon and notice the private events that show up. So when you start saying lemon, for me, I start feeling that salivation and noticing the taste of the lemon. I can kind of, right now, I can kind of smell the citrusy smell, and I can feel the peel, and I can see the juice and think about the sharpness of the juice. And so I can conjure up these properties that are very, almost like actually having a lemon here in front of me. And once you do that, then you have the person start repeating the lemon word. So you start saying lemon, 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 lemon for about 30 seconds. And the more you repeat it, the more it starts to lose those properties that you were conjuring up originally, and it just starts to sound like a nonsense sound. And basically that's all it is. Words are just essentially sounds that we then, through this process of, or the RFT process of deriving relations, we attach meaning to, and then words can take on the function of actual real events, and then we start responding to them as if they have the same functions as the real events. So all the diffusion exercises are kind of similar to that Titchener's repetition. They work in the same way to try and get you to see that the words are just words, and then you're able to respond to them in different ways. So the second process that I want to talk about today is acceptance. Acceptance is essentially the opposite of experiential avoidance. So what we see is human beings are programmed to avoid things that are aversive. It makes sense. In the wild, if you're out in the Serengeti and there's a lion, you need to run away from it. Or if there's something else painful happening to you, you need to try and stop the pain. So it's a functional way to be, essentially. But unfortunately, oh, excuse me, something has popped up. You just close this. There we go. Okay. So essentially, now I've lost my train of thought. Okay, so I was talking about experiential avoidance. So the problem with thoughts or verbal behavior is we can't really escape thoughts. Thoughts are just going to keep coming into our heads. They're not real lions in the grass. They're not snakes. They're not actual things that we need to escape from. So just like the lemon took on the properties of the actual, the word lemon takes on the properties of the actual lemon. It's not a real lemon. Essentially, it's not. I can't respond to it in the same way. So acceptance essentially tries to minimize your attempts to control or modify private events, because it's really a fruitless battle. If you've ever tried to not think about something, you'll know that it doesn't work, and that even by just saying to yourself, don't think about the pink elephant, you're already thinking about the pink elephant. Trying to control and get rid of private events doesn't work. So what acceptance does is it tries to get you to let those thoughts and feelings be there, even though they're really difficult. So I like to think of it as making room for whatever is showing up for you. So whatever feelings and thoughts are present, and just letting them be there without acting on them. And by doing that, you actually decrease the impact of those problematic private events by generating a willingness to be able to contact the uncomfortable stuff that goes along with them, and in the service of moving towards your values. So here's some layman terms for acceptance. I should say that all the processes can be thought of in a number of different ways, and there's lots of different metaphors that you can use for these processes, and you will probably find one speaks to you more than the other. That's why I'm kind of including lots of examples. So for me, I like to talk about opening up or making room for these difficult things, but other people might find it more helpful to think about stopping the struggle or dropping the rope, and freeing yourself up to do other stuff, or like holding thoughts and feelings lightly. So there's lots of different ways to think about it, and you will find the way that makes sense to you. Another way to think about it would be just allowing stuff to be there, and cultivating willingness. And if you think about that lady that we saw in the cartoon earlier on, who was like holding her thoughts right up in front of her face really tightly, acceptance would mean letting that sit, setting that down. So setting those thoughts down or folding them up and putting them in your pocket. So they're not going anywhere. They're still there. They're still not nice, but you are freeing your hands up, or freeing yourself up in general, to be able to then get on with doing the things that you need to do. That lady can, if she puts it in her pocket, she can now cook, she can care for her baby, she can drive, she can go to work, she can even just see better. She can see everything that's going on around her, as opposed to just clinging on tightly and having those, struggling with those thoughts right up in front of your face. I should also say that acceptance, sometimes I have people have a difficult time with it because they think it means being fine or okay with things, but it really doesn't. It does not mean being like, oh, I'm okay with that and that's fine. It just means letting it be there. So that's not the same thing. And it's also not the same thing as really tolerating difficult things, because tolerance kind of implies that you're still struggling with it in some way, or you're trying to be fine with stuff. And it's also not giving up and just laying down and resigning yourself to your situation. So some classic examples are the quicksand metaphor and the wading through the swamp metaphor. Again, it was difficult for me to choose which ones to bring to the presentation, because different metaphors speak to different people, and some are more meaningful for others. So it was hard to know what would be the best one that might speak to the most people. But the one that I chose was the quicksand metaphor. And so everybody knows, or should know, possibly knows, that when you're in quicksand, not that I've ever been in quicksand, but I learned as a child, I remember, must have been watching a film or something, I think maybe Jason the Argonauts or something like that. But when you're in quicksand, you're not supposed to struggle, but your intuition tells you to start struggling to try and get out of the quicksand. But of course what happens is you just keep sinking further and further into the quicksand. So if we think of the quicksand as being our thoughts and feelings and trying to get away from things that are difficult, private events that are difficult, when we're trying to control them and struggle with them, we're essentially just getting more and more involved and lost in the smog of all those thoughts and feelings. We're sinking into the quicksand. So the way to get out of quicksand is to kind of do something that's totally counterintuitive, and that's to stop struggling and to actually lie flat and just open up as much surface area as possible, letting the quicksand touch as much of your body as possible. And so if we think about, again, the private events metaphor, we have to stop struggling in order to kind of find a way out. We need to stop struggling against, or help parents to stop struggling against, those problematic private events. And acceptance is all about that, just lying back and allowing those difficult things to touch us and be there. But when we do that, then we free ourselves to be able to see other ways out. So with the quicksand, if I'm lying flat and I stop struggling, I might start noticing, oh, there's a branch over there that I could grab, or maybe I'll see that there's a person coming to help me. Another way to think about it is the fly. I think that one is quite useful. But a fly, when you see a fly kind of butting up against a glass door or something, and they just keep doing this unworkable thing where they're just butting and trying to get out through the glass window, and no matter how many times they hit themselves against the glass window, they just keep doing it, rather than if they actually stopped and turned around and did something different, they could see like a bunch of other options for getting out of that room. So essentially, with acceptance and defusion again, but acceptance particularly can help parents be more willing to work through challenging situations that arise during parent training. So especially if you think about the classic example of an extinction procedure, extinctions procedures are really, really hard for anyone, for parents to work through, because a lot of stuff is going to show up for them when their child is having a tantrum. All sorts of evaluations about themselves as a parent. My child's crying. This is too hard. I'm hurting my child. So like all this difficult stuff's going to come up as they're trying to work through it. So if you can work with a parent to not only help diffuse from those thoughts and feelings, the thoughts that are showing up, so they don't have as much power over the parent, and you can help them practice acceptance to be able to go through that experience with the long-term goal of ultimately helping their child and being the parent that they want to be, then you're going to have a much greater success rate at the parent being able to continue to implement that really difficult strategy. And then they're going to start contacting the positive results of that, because they're not sticking to the rigid rule. They're going to start seeing the improvement in the child's behaviour, and they can see kind of the bigger picture. And in addition, the thing about acceptance that's really great is that it facilitates self-compassion. So by practicing acceptance, you can encourage parents to be gentle with their pain, because they're not struggling against it anymore. They're letting it be there, and they can start being kind to themselves and not continuing to feed that pain. So just a couple of things to consider before we wrap up. What I notice, and quite commonly behaviour analysts working with parents need to be aware that they don't really get a lot of training in core interpersonal or therapeutic relationship skills. So some of them are very good at these things naturally, or they have other experience. So they maybe come from a different kind of background, like a counselling background or a clinical psychology background or MFT background or something like that, where they're given specific training in how to develop a strong therapeutic relationship. So I'm talking about things like listening skills, ability of practice validation, and also perspective taking, just being able to put yourself in a parent's position and not and be able to react with more empathy. And because why that's important is because we know from the literature that building rapport with the person that you're working with is one of the key variables in intervention success across the board, whether you are a behaviour analyst or a clinical psychologist or social worker or nurse or doctor. But that the rapport that you build with the person that you're working with is extremely important. And unfortunately, a lot of our practitioners don't necessarily know how to build that rapport. So we really need to think about that. And secondly, and I will be doing actually another training specifically looking at this issue in November time, but the practitioner themselves can bring their own private events to, obviously they bring them to the situation with the parent. So of course we're all human beings, and that means all the processes that we talked about in this training apply to us as well. And so we can get in our own way of doing our best work because we start behaving with respect to the stuff that's going on for us, rather than actually being present in the moment and able to actually hear what a parent is actually saying to us, or know how to behave effectively with respect to the parent, because we're too busy kind of lost in our own stuff. And I see that a lot. And so because of those two issues, you might want to think about, which is what we're doing in my organisation, think about a top-down approach when you're introducing ACT to behaviour analysts that you work with. So you might want to kind of introduce ACT processes to the staff first. So having the staff use those practices in their own work and use them on themselves. And what I've found is that you can get really good buy-in then from staff, because they see them working, and if they've done them on themselves, then they understand how they work, and they can see that they do work, and you can see the benefit, and they're going to be better at using them with parents. And in addition to that trickle-down effect, we also see, hopefully, and there's research showing that this should be the case, but that you can see a decrease in staff burnout and stress, and that obviously then has an impact on our families too. They have much more effective clinicians. And in addition, increased empathy and perspective taking. So a lot of the ACT metaphors and exercises involve perspective taking. So putting yourself in someone else's position, or this is what we do with staff anyway, putting yourself in the parent's position and seeing what it's like to be a parent, experiencing their minds kind of screaming at them while they're trying to interact with a clinician who's also telling them that they're not good enough and they're not doing their job well enough. And when the clinicians kind of experience what that's like, then they're much more able to, or they're much more effective at the interpersonal interactions with parents, particularly with a parent who is angry or distressed. And in addition, like considering adding some key training in, say, active listening and validation could also be extremely beneficial to improving these outcomes with parents. So just to sum up, we talked about how parents of children with autism show some of the highest levels of stress, relationship difficulties and mental health issues amongst parents of children with a variety of disabilities. So they really are having difficult time, the majority of them, not all of them, but a lot of parents are experiencing a lot of distress. And then given the challenges of raising a child with autism, so given all of that stuff that they're dealing with, it's really understandable that our parents that we're working with are struggling sometimes to stay committed to the treatment program. So even if they manage to comply initially, it can be really hard for them to maintain that compliance. And we know that private events have been largely ignored in the literature so far for parent training, but that they may play a significant role in determining parenting interactions. So it's really important that we acknowledge their existence and look at how they might be affecting parent behaviour and the effectiveness of what we're trying to do. So again, behaviour analysts should attempt to understand how private events might create barriers to effective parent training. And ACT, as we introduced it today, potentially offers us a variety of strategies for dealing with problematic private events, and it might be particularly useful for this population where the problems are chronic and stressful and they're not easily corrected through normal problem solving strategies. In fact, I saw a quote in something a while ago, and it said that parents were reporting like their sense of crisis was just ongoing all the time. They just felt like they were constantly in a crisis situation. And practitioners as well might benefit themselves. I highly, strongly recommend that practitioners actually use ACT training themselves, so that they can make sure that they're not getting in the way of themselves doing the best job that they can do, and to see these trickle-down effects or kind of like a cultural change in the organisation. And like I said, I will be doing another training, I think on the 14th of November, that's looking specifically at how practitioners can use ACT in their own workplace in order to maximise their effectiveness at working with parents, and in particular working through difficult interactions or particularly challenging clients. And that is the end of our presentation today. Thank you very much for attending. I'm not sure if we have any time to answer questions. Emily, do we have time? Okay, so I'm just going to have a look at some of the questions. I'm sorry, I'm new to this system, so just bear with me till I find the questions. Okay, so somebody had asked how much knowledge of RFT is needed to implement ACT well. That is a really good question, and it's one that's ongoing. I see on the listservs all the time. But I would argue that if you think about, say, Super Nanny, or as clinical psychologist who's using principle of reinforcement, or say using a timeout procedure, you might be able to do it well, but if you don't have an understanding of the theoretical underpinning or the science behind what you're doing, when you encounter some issues or if something doesn't work, you may not know what to do about it. So I think that it probably isn't essentially necessary to be able to do ACT well. I think there's probably a lot of people out there who do a really great job I know there's a lot of people out there who probably practice ACT very well without knowing a great deal about RFT. But if you do have an understanding of the science behind what you're doing, you're likely to be much more effective and be able to be more flexible in how you apply apply the strategies. And you're also going to be at an advantage in terms of whenever what you're doing isn't working, because you'll have a means to understand why it's not working. I don't know, I hope that answers your question. I don't think that you need to have an extreme kind of overall knowledge of RFT, but some basic understanding I think could really help you. Are there any ACT protocols that I can follow while doing parent training? No, I think the answer to that is no. There aren't any specific books or protocols for using ACT with parents, although there is one book by Lisa Coyne called The Joy of Parenting, which is an ACT. It's using ACT to parent in the early years, so it's not specifically focused on parents of children with autism. It's just focused on typical parents with young kids of up to around 5 years old. But it's the one book that there is available. And if you go onto the Contextual Behavioural Science website, they also have a lot of, if you're a member of the Association for Contextual Behavioural Science, you can get access to all manner of protocols and lots of resources there. But there's nothing that I'm aware of that's specifically doing that. We are developing something at my organisation, so the Institute of Behavioural Training and CARD, Centre for Autism and Related Disorders. We're developing, in the process of developing that ourselves. Are there any good books covering ACT? There are any number of very good books. So if you're interested, I would say for beginners, there's a book called ACT Made Simple by Russ Harris, and it's basically what it says on the tin. He really does a very good job of introducing you to all the ACT concepts and processes and techniques in a very understandable beginner way. The only thing is to bear in mind that he is coming at it from more of a psychotherapy point of view, where he's working with clinical disorders or mental health issues. So you wouldn't necessarily be applying the protocols in the way that he's describing it, but it's certainly an extremely useful introduction to the concepts and the whole model. And Russ Harris also has some very good self-help books that I highly recommend. They're very easy reading. He has a very good one on relationships called Act with Love. He has another one called The Happiness Trap. He has a bunch of them. And actually he has one that he wrote called The Reality Gap. And he wrote it after he had his own son diagnosed with autism. So I think that's a particularly useful one that you might even want to recommend to parents, or look at yourself, because he talks a lot in that book about his experience of being a parent of a child with autism. And he actually had his child in an ABA program, and then he supplemented that later on with an RFT-based intervention program. So that's kind of useful. It's very short, very easy to read. I recommend that one. And of course, there's a lot more technical books. There's one, if you're interested in RFT, actually, there's one that's just out that's a bit easier called Learning RFT by Nicholas Turnica. That's a very good book. And then there's the traditional ACT and RFT books that are more technical if you're interested in more academic resources. Is it okay for Emily, how much time do I have left? Okay, so there's another question here. Is it okay for BCBAs to do ACT if they read up on it, or is there a formal training or certification needed? That's a really good question too. There's a couple of things that come to mind. So it's okay for BCBAs to use ACT techniques. It's essentially the same as a clinical psychologist using reinforcement, in my mind, or using a token system in a school for a teacher. You can use these behavioural strategies. Obviously, you need training if you're going to be using them effectively. Just like we want to train teachers to implement the token strategy effectively, and we train parents to follow through with the timeout procedure effectively. But that doesn't, but as you can, of course you can use those strategies. It's better to get training, because reading about stuff, as you guys know, doesn't necessarily mean that you will be able to implement it. So that practice in person and actually doing more than just reading about it is going to help you be able to use it with other people and apply it flexibly and be effective. There isn't, in terms of certification though, there isn't a certification that you can get. And part of that is deliberate, a deliberate kind of decision by the ACT community, because they don't want to make it something that's exclusive. So it's only a thing that psychiatrists can have access to, or it's only something that clinical psychologists have access to. They want everyone to be able to have access to ACT and be able to implement it in their practice. This is why when I go to ACT trainings, I'm sitting in a room with, yes, I'm sitting there with psychiatrists and clinical psychologists, but I'm also sitting next to physiologists and paediatricians and nurses and social workers and counsellors and coaches and sports trainers and like all sorts of nurses and like all sorts of people, and then of course myself, because you can really use these strategies to improve your effectiveness in your work of anything that you're doing. So there isn't a particular certification you do, but there is formal training. So you can go through formal training, and you can also, it's recommended that you get a mentor who can help evaluate your practice and walk you through a bunch of competencies. So there are specific competencies that you can go through to make sure that you are actually practicing ACT in an ACT consistent way, and that you're being ethical in your practice. Where can I find ACT therapists to refer a parent to that I work with? That's a great question. You can go to, I recommend going to the Association for Contextual Behavioural Science. Their website is actually, I think it's contextualscience.org or .com. I would need to look that up. But if you look up the Association for Contextual Behavioural Science, when you go to that website, you can see there's an ACT for the Public tab. And under that, you can put in your area and you can search for an ACT therapist in the area. .org. Emily says it's contextualscience.org. So that's the same website I was saying you go to for a bunch of different ACT-related resources and RFT resources. But you can go there and find a therapist as well. And you can look at like their experience and their training and their general approach and choose who you think is most suitable for the parent that you're working with. I think that's about it. Let me just check if there's any more questions. I'm not sure. There's a question here, but I'm not sure. Will you be sharing a sample lists of rules that you have used? I'm not sure what that means. I'm sorry, I'm not understanding what the question is. If you can email the email that Emily, can you put that up on the screen, or do I need to do that? Okay, so if you have questions, or that person who asked that question, if you want to email that email address that Emily put up on the screen, I'd be happy to talk with you a bit more and get your questions answered that we didn't have a chance to do today. And you're very welcome to contact me for any other information if you want some lists of resources and so on. I'd be happy to share those with you. And of course, please feel free to come to the next training that I'm doing in November, which is specifically teaching you how to use ACT on yourself to improve your own practice when you're working with families. And that's about it for today. So thank you very much for attending.